And we are joined by uterine artery embolization specialist, Dr. Bruce McLucas from UCLA Medical Center, as well as Aisha. Welcome. Now, Aisha, I see women like you all the time in my office, and tell me, how did you find out about your fibroid? What were you thinking? Were you having any problems?
About 2 years ago, I noticed that I couldn't lay on my stomach when I was sleeping. I couldn't lay flat on my stomach. It would be very uncomfortable. And then I started getting sharp pains, and I said, something's just not right. And then my stomach kept getting bigger, but it was getting harder, more on one side than the other. So I finally went to the doctor. They did an ultrasound and MRI, and they said that it was fibroid.
So you could actually feel something?
Yes, I could press on my stomach on the side and feel a hardness that it was a mass.
Did you have any pressure on your bladder or
yes,
anything like
I had to go to the restroom all the time.
And how large was the fibroid when you went to the doctor?
By the time that Aisha came to visit us, our uterus was about the size of a 4-month pregnancy or a small watermelon. Depending where they are, though, Dr. Lisa, they can be the size of a cherry tomato over here inside the uterus.
Right.
And a woman can have acute bleeding and be terribly anemic.
And that's right. And exactly what Dr. Lucas is talking about here is where the fibroid is so important. Basically, this is your uterus, and you can have fibroids on the top or on the outside sort of this area here. You can have them inside the uterus, so they can be really large. And if they were inside the uterus and large, you wouldn't actually see that much outside here. And so you wouldn't be able to feel it as much as if you had a large fibroid here or here, which is closer to the outside abdomen, and then you're going to be able to feel it really well. And that's why actually your doctor does an exam. They put one hand inside of the vagina and one hand on the outside, because what we're doing is we're trapping this uterus, and then we rub our hands around here, and this is how we're able to feel the extent of the fibroid, to feel if it's on the front, if it's on the back. But the ones that are most elusive and actually cause the most bleeding are the ones that are inside. And that's why often you'll need an ultrasound or an MRI to find out about these things. Typically, to get these fibroids out, what we do as gynecologists is we can either do a laparoscopic myomectomy or an open surgery myomectomy, where we just remove the fibroids, or a hysterectomy, which is just removing the uterus as well. But there's also something called hysteroscopic resection, and that's when we go inside the vagina, in through the cervix, and we resect the fibroids in here, but they can usually only be of a certain size. So you have to have the right patient for the right procedure. And with uterine artery embolization, what we do is basically the radiologist will, through one of the arterial system that supplies the uterus, will actually feed a catheter up through there and inject a material that will occlude the blood flow to those fibroids. So basically, the fibroids die off. All right, they shrink and they die. So again, the other ways we have to do this are surgery, some medications, but again, you do the uterine artery embolization. So tell us more about that.
The uterine artery embolization is a wonderful improvement for surgery. I mean, Aisha had this procedure less than a week ago, and she's sitting here smiling. If we'd have done a big...
Feeling good, less than a week?
Good,
wow.
Yeah.
If we'd have done a major surgery, she wouldn't be smiling at this point.
You look fantastic.
Thank
She
you.
does.
Thank you.
So that's really what it is. I mean, a little tiny incision in the groin. There's no sutures, no scalpels, no surgery, and bleeding stops immediately. And the most important thing for our patients, Dr. Lisa, is there's no recurrence.
Okay, that's great. That's really great. And thanks, Dr. McLucas and Aisha.